Hi guys, welcome to my YouTube channel. For those who are new here, my name is Alvina Shipingana. I'm currently working at the Shakati Intermediate Hospital as a maxillofacial or dental surgery assistant. So in today's video, I'm going to show you on how to prepare a tray of IMF. When do we do IMF? We do IMF when there's a patient with fractures. Which fractures? Like those simple fractures. Mandible fracture, like tooth fracture, angle of mandible, symphysis or parasymphysis fractures. The only tray we don't set up is the tray of olive, multiple fracture or maxillary fracture, whereby we don't have to prepare a tray within our operating room. That one we do at main theater, whereby the patient has to undergo general anesthesia. First of all, before you prepare a tray, you have to wash your hands. Before you wash your hands, first you have to open your gloves and you put your surgical gown ready. You open it like that, then you put it on your sterile tray. From there, you go to the tap or basin, wash your hands, you put your soap, you wash your hair, you scrub. We don't say you wash. Medically we say you scrub your hands. You put you apply, you wash nice, everything you wash, then you wash, then you wash with it, you rinse yourself. Okay, you take your course, you draw, even the towel paper, anything that you have to dry your hand. After that, you come here straight. Don't touch anything. You just come here straight. You take your gown. You put it on. After putting it on, don't tie yourself. Tell someone to help you tie your gown. Let me assume I put it my surgical gown. Then you go here. You put your glass, sterile glass. Then you take your instrument. Which instrument I'm talking about? IMF instrument. First of all, you must have a syringe, tender syringe. Usually, I don't keep the syringe for the trust of the patient. I only put it this way. And when I'm going to keep the syringe, the dental syringe, and to put in dental cartridge, I make sure the patient is looking at me. Here we go. Let me assume I'm on the table where the patient is. I put it on. Then I put the cap on. Then that is a dental syringe. This is an anesthesia. Usually this is an injection for the patient not to feel the pain during the procedure. Make sure you have the 4 cartridges. When do we use 4 cartridges? This is number 1 cartridge, number 2, number 3, and number 4. When do we use 4 cartridges? We use 4 cartridges when the patient is having only 1 fracture. For example, the patient is having only the fracture of angle of mandible. You prepare 4 cartridges, like for the both quadrant 1, 2, 3, and quadrant 4. If they come a patient with 2 fracture, like a fracture of angle of mandible or the body, or like the symphysis fracture or parasymphysis, then you prepare 5 cartridges. You prepare your syringes. There also must be the spatula for the doctor to use when infiltrating the anesthesia. You must have the wire cutter to cut the wire. You must have your wire, any wire the doctor asks you to do, but usually we use 0.18. You must have two needle holder to hold the wires. How big? Some of you might ask yourself, how big is the wire? It's not that long and not that short. It's only of this size. You stretch it nice with your needle holder. You stretch it. Let me show you for you to have a clear picture, so that when you guys come to a Shakati Dental Clinic, you are already fine. First thing of coming here and you don't have a clue, it's always, you find it difficult. Don't be shy. You stretch it. You see? Why do we stretch it? Here is the reason. When you put the IMF in a patient's mouth without stretching it, within 2 or maybe 1 week, those wires are loose. Why? Because you did not stretch. The patient, when he's trying to open the mouth, the wire is already stretchable. But if you stretch it, it keeps the wire hard. Whether the patient is going to open the mouth in what way, unless the patient cut the wire, but like this, it keeps it harder. You cut your wire. Let me not cut, I'm just showing you of this size. You cut, and you cut this edge. You see, it's not straight. Make sure your wire is very straight. You prepare your 4 wires. 1, 2, 3, 4 wires. Then you put it on your tray. After cutting your wire with the prepared needle holder and wire cutter, this is a wire cutter to cut wire, you must have retractor to retract the cheek from disturbing when to make the patient the dentist there.
I like my video. My idea is clear.
See the retractor to retract the cheek like this for the doctor to see when he or she's doing IMF. Off we go. Remember to have a suction. Always a suction. To suck the blood or anything from the mouth. Let me assume the doctor has done with IMF. You prepare everything, you put it on the table, then you start with the procedure, suctioning. After all, you will remove your gloves. Don't forget the gloves, but your glove must be sterile, as I showed you in the last video. You remove your gloves. You just pause. Then you take a wax. This is a cleaning wax. You see? Cleaning wax. What is a cleaning wax? The cleaning wax, you open it like this. You open it, you put it like this. That's the way I put my gloves. It's only that I want to keep it sterile. If you open it, if you open it and you did not use it, throw it away because it's already contaminated. You put it. You take the bandage. You open, you put it. From there, you take your gloves. Sterile gloves again. Or you can wash your hands again, or you can use alcohol. Then you put on your gloves. You give the doctor the cleaning wax. What do we use the cleaning wax for? The cleaning wax is used to protect the patient from being pricked by the wire in the mouth. Those irritating wire that could prick the mucosa. What do you mean about the mucosa? It's just a soft tissue the soft thing that you are seeing in your mouth, the soft one, not to be plagued by the wire. You just give in a small amount, make it soft, then you put where the wire are. From there, the doctor will leave everything in your hands. You put the bandage. Do you know how to put the bandage on? And you must also have your plaster. This bandage, you take it out, then you wrap. When you are putting the bandage for IMF, this is good for you. You include the chin. First, you have to hold the chin of the patient and tell the patient not to move or to open the mouth because he is having wires in the mouth. That is gonna be there for 1 month and 2 weeks, which is giving you 6 weeks. You wrap it involving the chin. Make sure the chin is held by the bandage. You wrap it, then you put a plaster. After that, remove everything with your gloves on. Remove all the used instrument and put it in a basin where there is soap or where there is biocide. From there, you wash your hands, you wipe. Then you tell the patient, ma'am or say, what the doctor just did is IMF, as we have explained for you at the beginning. Here are the post-operative instructions. This is very important as an assistant to give instruction to any patient that you did a procedure. Number 1, you are going to close that mouth. Don't try to open for 1 month and 2 weeks. Do not try by any means to open or to remove that wires. Otherwise, you distract your treatment. As your bone is going to the bacteria is going between the bones where the fracture is and is going to destroy your bone, whereby the osteomyelitis is going to be. The patient is going to close the mouth and tell him that if he by means anyway remove that wire, it's going to distract his healing. The bone is not going to heal in a normal way. It's going to heal in an abnormality way. Let me say the fracture was like this. This is the jaw. And the doctor put it on the position. If the patient happened to open or to remove the wire before the due date, the healing will be like this. And the occlusion will be mild. So, tell the patient that he's going to eat soft diet only. I mean liquid diet. Milk, soft diet only. And here the patient must brush the teeth. Tell the patient that losing weight is normal to any patient who is done IMF. Losing weight is normal. Don't forget to tell the patient that if you see that your wire are being loosened or one wire break, come back immediately to the hospital and the IMF could be corrected or the wire could be corrected. Tell the patient not to touch any wires. For the effectiveness of the patient or for the good of the patient, some patients are staying far. Give the wax and tell him how to use it. Once you see that the wire is breaking or the other wax that we put is old, put a new one. Thank you for watching. Bye. In the next video, I'm going to prepare another tray for surgery, general surgery.